why is this important, right? Why do we have a session about this? Why do we talk about it? For a couple of different reasons, right? So we certainly want the representation of what we see in our research to represent what we see in real life, right? So we want to make sure that we understand side effects, how they may occur in different people, the efficacy or effectiveness of different drugs in different groups. We want to make sure that we document the unique differences due to our cultural, environmental factors, as well as physiologic or biologic factors. Certainly, it makes it difficult to generalize the findings, right? If we have research studies and there are only, 4 or 5 Black people in those studies, how do we generalize those findings to a whole population of people? And this was based on a paper talking about encouraging participation of minorities in research studies. Next slide. So what are some of the barriers, right? I think one of the important things is that traditionally when we talk about enrollment or involvement in clinical research, people talk about it as a lack of participation, which in a way is true. But I think that when we talk about it in that way, we put all of the onus and all the blame on the patient, right? Which is not true. There are many barriers to involvement in clinical research. So there are patient barriers such as lack of opportunities, lack of awareness of research opportunities, certainly understanding the consent forms. In some cases, there may be lack of trust. Certainly, some people may have cultural beliefs that may clash with involvement in research. Also, there can be institutional barriers, so healthcare provider bias. Many people may not be asked to be involved in clinical research. When we look at the inclusion and exclusion criteria for research, sometimes it's very restrictive and may exclude groups of people. For instance, people who have comorbid conditions such as diabetes or hypertension, et cetera. Because the criteria is so narrow, they may be excluded from trials. Also, we have to diversify the researchers, right? If you only have a certain group of researchers, you may not get some of the questions that need to be answered in other communities if we don't have researchers that are diverse and from those different communities. Also, some of the barriers are the in-person time commitment. So the way that research has traditionally been done has been very heavily weighted on someone coming into the office, getting different assessments. You may have to be there all day. If you have to do that 5 or 6 or 7 times and you have a job, that can be difficult, right? To take all of that time off work, especially when you're not compensated for that time. And then we also think about things like the selection of sites. So where's research being done? Is research being done in our communities, or is it often being done in other places?